From the PEP Radio Newsroom, we have this news about vaccines. In the midst of what could be one of the most severe flu seasons on record, Health Secretary Robert F. Kennedy Jr.'s CDC has ceased recommending all children get vaccinated for the seasonal flu, along with 5 other previously recommended vaccines. Guided by RFK Jr.'s hand-picked anti-vaccine advisory committee, the CDC's new childhood vaccine schedule reduced its recommendations from 17 immunizations to 11 on Monday. Rather than cite data, Kennedy Jr. said that the decision was made to better align the United States with peer-developed nations, citing Denmark in particular, which immunizes children against 10 diseases compared to the 18 previously recommended in the U.S. The decision baffled experts outside RFK Jr.'s purview. There is no scientific evidence supporting the change in recommendations, and therefore Mr. Kennedy was unable to provide any, said Beth Jacobs, Ph.D., an epidemiologist and professor emerita from the University of Arizona who has studied vaccine refusal. Jacobs is also a founding member of Defend Public Health, a volunteer network of health professionals combating health misinformation. Instead, HHS said that fewer people getting vaccinated was a reason for the change. She said, "You do not need to be a scientist to know that this is nonsensical, and I do not believe that the changes reflect the opinions of expert CDC scientists." CDC's flu vaccine downgrade coincides with a sharp spike in hospitalization for flu-like illness across the country. Data released Monday by the CDC shows. The agency estimates there have been 120,000 hospitalizations so far this season, nearly a 50% increase compared to the prior week. Around 8% of healthcare provider visits during that period were for flu-like symptoms, the highest since 1997 when the CDC first started tracking that data. While the 2025-26 flu vaccine isn't as effective at combating this season's flu strain as it has been in prior years, it remains remarkably effective at keeping kids from getting seriously ill. Compared with their non-vaccinated peers, data collected in England show that kids who got the flu vaccine this year are still 72 to 75% less likely to be hospitalized with the disease. It's not too late to get kids vaccinated, said Jacobs. The American Academy of Pediatrics now releases its own evidence-based immunization schedule that Jacobs recommends parents follow instead. In addition to hepatitis B, rotavirus, and influenza, the CDC also no longer recommends widespread vaccination for hepatitis A, certain forms of meningitis, and RSV. That's what we know for now. From the PEP Radio Newsroom, I'm David Moore.